And welcome back to A New You, Maximizing Life with a Disability. I'm Scott Chesney. Today I'm joined by licensed physical therapist and also certified yoga teacher, Karen Bay. How are you, Karen?
I'm doing well, Scott.
Great to see you.
Great to be here. Thank you for having me.
Now, you know our population, people with mobility disabilities. Kind of like people who don't have disabilities, we're all creating excuses these days. We're all saying, I gotta get to the gym or I have to exercise, but we create excuses. We don't make it happen. We understand the importance for exercise, for all of us. Why is it even more important for those of us with mobility disabilities?
So depending on the disability, and in this case I think we're talking a little bit about spinal cord injury, there is a much greater risk of cardiovascular complications due to a variety of reasons following spinal cord injury. So for one, the loss of lean mass, so that affects your metabolism, poses risk for weight gain, abdominal obesity, which we all know is a risk factor in cardiovascular disease in general. And there are a lot higher statistics of cardiovascular diseases in those with spinal cord injury. So it's even that much more important to get out there, really exercise, move, and find ways to move. And like you said, I think people do make excuses. I don't know how to do it. What am I supposed to do?
I'm gonna get all sweaty and
how do I get my heart rate up if I have an autonomic dysfunction? And I think that's a valid point.
If you can't get out of your house, and let's say inclement weather or something like that, what are some things that we can do to get our heart rate going?
Okay, so like anything else, you have to adapt, right? So there are those excuses, but there really don't have to be that many excuses. So there are a lot of pieces of equipment that we can use at home. Something as simple as pulling up a chair in front of you. Maybe you're sitting in your chair, you have this chair in front of you, you're doing push-ups, maybe you're doing trunk flexion extension, you're alternating the rapidity with which you're doing it, maybe you're doing longer duration. There's different things that we can do. We can use TheraBands, so that is probably the most simple thing that we can utilize for resistance exercises, right?
So there's different types of TheraBands, almost like weight resistance, one stronger than the other.
Definitely. So the darker ones are a little bit stronger than the lighter ones, and the yellow is pretty light. So it depends on where you are with a particular muscle group. You have to factor in weaknesses, and also you want to avoid any kind of shoulder injuries. If you're having difficult time reaching overhead, you're not going to do those types of activities, but we are going to focus on maybe working more of the back. So the things that you could do are really do a lot of intervals. So maybe you're doing some slower repetitions followed by 20 really quick repetitions, and that seems to do the trick. So pulling in things like circuit training, so maybe you'll set up within the home a couple of different activities. So maybe we're doing some chair push-ups over here, and then we're wheeling over to this setup over on this side where we're doing some chest press with our TheraBand or shoulder abduction. Those are both great exercises for the posterior musculature, around the shoulder blades, and help us be able to keep our shoulders healthy. So those are things that we can do. We can set up circuits, we can do interval training.
And that's still all getting the heart rate going.
You're getting your heart rate going. And then the other thing that we can think about doing is maybe getting a tabletop UBE, so an upper extremity ergometer. That's something that you can also use to pull in there. So most of the time pulling backwards I recommend, although you can
reduce the wear and tear on your shoulders.
Yes, which Scott, you know all about.
Had shoulder issues in my day.
Yes.
Absolutely. One of those things too is that a lot of people, it actually was used by physical therapists first, and then it was commercialized, was the Wii. To actually get your arms going and pumping, the whole rehab. There we go, rehab. So something like that, if you have that, again, it's more so used for enjoyment and entertainment now, but it's a great exercise in itself.
Absolutely, and I mean, those who know me will know that I say this, but you got to put the fun in functional. So if it's not going to be fun, you're not going to want to do it. So even with all of these activities, you can throw some music on. Maybe you're dancing. Maybe you're doing your exercises in time with some music that you're really into at that time, but anything that's going to keep you motivated is a good thing. So I think the Rehab speaks to that as well, because it's really motivating, it's fun, it's interactive. You get to share that experience with maybe a sibling or someone else in your life where you get to just have a good time. But it's also good for you. You're reaping the benefits.
The benefits, if you can get to the gym, if you can get a trainer, there are people who can help you to, again, build up those muscle groups that are still very active, as well as getting that cardio going.
Absolutely, and you will have access to more equipment if you go to a gym. So I think that's a great idea. I think asking for a personal trainer that has experience with somebody who does have a mobility limitation and is familiar with making adaptations and modifications, and someone who's really in touch with what it means to have a certain level of an injury and what your capabilities are versus maybe things that are a little bit tougher for you. Those are questions that you want to ask before you get a trainer, but certainly there are people out there. Personally have experience with a few patients of mine or clients who have gone to a JCC or a Y locally, and they've had some really, really great experiences with those trainers, and it's pushed those trainers to a different level than they were used to. You know, here they were just really getting people pumped up, and now they're helping someone walk.
You just mentioned that you are a certified teacher in
I am.
yoga.
Yes.
How is yoga beneficial? Because a lot of people might think, well, wait a minute, this is kind of stationary, this is still, this isn't really getting my body or my heart rate going. Why is that so important to complement to maybe a regular exercise routine?
So there are great things about yoga from the physical sense. Stretching out tight tissue, right? If you think about any type of spinal cord injury, there might be spasticity, some contractures. Yoga is a great way to go back in there and loosen the tissue back up. And that allows the pelvis to sit more naturally and more optimally within the wheelchair. Also allows the shoulders to be open and better dynamics at the shoulder, which reduces risk of shoulder injury. And then I also think from the emotional and the psychological standpoint, it's a really important intervention. So if you look at it from a purely physiological sense, there's a connection between deep breathing and the vagus nerve. So the parasympathetic nervous system can be activated when we're able to breathe deeply and sort of shunt our breath over the vagus nerve, which is a common practice in yoga. So yoga is not only just about the movement, it's also about the breath and the connection between the two. So in doing that, you're able to promote relaxation, really take the power back, so to speak, reduce your own anxiety levels, and it's something that you can always go back to over time. So of course it's excellent for the stretching benefits, but I think there's also the psychosocial part of it and the ability to really take control.
So I think Karen's given us our new challenges, as we call them, and we're going to go backwards based on what you just talked about, is that incorporating yoga into your daily lifestyle. Exercise daily. We're going to make that one of our new challenges. Well, getting outside, getting that fresh air, and creating exercises outdoors as well.
Absolutely. Going back to the I can't, I've heard so many times I can't, even with yoga. Well, we can still do yoga. How? Well, if you can breathe, you could do yoga. That's a really famous quote. But what about getting out on a hand cycle? So maybe your feet aren't going to do the pedaling, so we're going to start cranking with the arms. Maybe we're just going to go outside and try to hit a tennis ball from the chair. Aquatics therapy is another great one. So the local Y, JCC, they do have lifts. They can get you into the pool. You just really have to ask the right questions again. Is there someone there who is familiar with working with individuals that have mobility deficits that may need a little extra assistance in the pool? All these options do exist. We just really need to get out there and ask the questions, see what our resources are in the community, and get involved.
You heard it here from the expert. Karen, I want to thank you so much for joining us here on A New You. And just want to tell you that if you want to watch any previous episodes, and you really, again and again and again, repetition is the mother of skill. Look at that red button at the bottom of the screen, and you can subscribe so you can make sure that there is no episode that you will ever miss. And if you have any questions about today's episode or wish to make a comment, you can always email me at scott.chesney@newmotion.com. Again, scott.chesney@newmotion.com. I want to thank you for playing full out as always, and I want to challenge you to be the new you, the best you could possibly be. Make it a great day.